insulin resistance and hypoglycemia are two distinct yet interconnected conditions that can have significant impacts on a person's health. Individuals with insulin resistance struggle as their bodies fail to respond to insulin efficiently, leading to elevated blood sugar levels, while those suffering from hypoglycemia experience dangerously low blood sugar levels, which can cause symptoms like shakiness, sweating, confusion, and in severe cases, loss of consciousness. To manage insulin resistance, lifestyle changes such as diet and exercise are often recommended, along with medications like metformin that can improve the body's sensitivity to insulin. Treating hypoglycemia, on the other hand, involves immediate intake of fast-acting carbohydrates to raise blood sugar levels to a safer range. Risk factors for developing insulin resistance include obesity, sedentary lifestyle, and a family history of type 2 diabetes, while those at risk for hypoglycemia often include individuals with diabetes who are taking insulin or certain oral diabetes medications. Here are detailed aspects of these conditions, including their impact on health, prevention strategies, and approaches to long-term management. Primary cause: endogenous insulin levels versus exogenous insulin sources. Insulin resistance and hypoglycemia, although both related to insulin dynamics, represent opposite ends of the glucose metabolism spectrum. Insulin resistance, typically seen in type 2 diabetes, is a condition where cells in the body do not respond effectively to insulin, often due to chronic exposure to high levels of the hormone, leading to elevated blood glucose. Conversely, hypoglycemia involves low blood sugar levels and can occur in diabetics as a result of mismanaging exogenous insulin administration, or in non-diabetics due to a range of reasons like excessive insulin production or reactive hypoglycemia after meals. Distinguishing between the two can be pivotal in managing a patient's glycemic state, with insulin resistance requiring interventions such as lifestyle modifications and possibly medications to improve insulin sensitivity, while hypoglycemia necessitates identifying and treating the underlying cause, which might include adjusting the insulin regimen or dietary changes to stabilize blood glucose levels. Metabolic state: hyperinsulinemia versus low blood glucose. Insulin resistance and hypoglycemia manifest divergently within the body's metabolic state. On one hand, insulin resistance is a condition often preceding type 2 diabetes, characterized by the body's diminished response to insulin. This leads to elevated insulin levels, hyperinsulinemia, as the pancreas attempts to compensate by producing more insulin to maintain normal blood glucose levels. Conversely, hypoglycemia occurs when blood glucose drops below normal levels, triggering symptoms like dizziness and confusion. It's vital for clinicians to distinguish between these two states. Although both relate to glucose regulation, the former may lead to chronic health issues, while the latter requires immediate correction to prevent acute neurological effects. Typical onset: gradual progression versus acute episodes. Insulin resistance and hypoglycemia, although interconnected through the regulation of blood sugar, manifest quite differently. Insulin resistance is a chronic condition that often develops insidiously over the years. As insulin sensitivity wanes, usually due to lifestyle factors or genetics, the body struggles to maintain normal blood sugar levels, leading to an increased risk of type 2 diabetes. In contrast, hypoglycemia refers to the acute episodes where blood sugar levels drop below normal, triggering an immediate physiological response, such as shaking, sweating, and confusion. These episodes can be sporadic and are typically a consequence of medication, strenuous exercise, or insufficient dietary intake, rather than a gradual progression of declining health. Understanding the onset and progression of these conditions is crucial for accurate diagnosis and effective treatment. Associated symptoms: fatigue and weight gain versus shakiness and sweating. Insulin resistance and hypoglycemia, though seemingly diametric, share a direct link with blood sugar control, but manifest with contrasting symptoms. Insulin resistance, often a precursor to type 2 diabetes, develops gradually as cells in the body become less responsive to insulin, leading to elevated blood sugar levels. Individuals may experience persistent fatigue and unexplained weight gain, reflecting the body's impaired ability to utilize glucose for energy, instead storing it as fat. In contrast, hypoglycemia presents with acute symptoms such as shakiness and sweating caused by a sudden drop in blood sugar, often in response to excess insulin or inadequate glucose intake. Recognizing these symptoms is crucial for timely intervention. While lifestyle changes can ameliorate insulin resistance, hypoglycemia requires immediate consumption of sugar to restore blood glucose to safe levels. Management strategy: lifestyle modifications versus immediate glucose administration. In managing insulin resistance, lifestyle modifications serve as a cornerstone to improve insulin sensitivity. These changes include adopting a balanced diet rich in fiber, engaging in regular physical activity, and maintaining a healthy weight, which together can improve the body's response to insulin. On the other hand, dealing with hypoglycemia, a condition characterized by abnormally low blood sugar levels, requires immediate glucose administration to quickly elevate blood sugar levels and prevent potential complications such as loss of consciousness. These contrasting management strategies highlight the tailored approach needed to address the variability and complexity of metabolic disorders. While long-term lifestyle adjustments are crucial in mitigating insulin resistance, the acute management of hypoglycemia necessitates rapid and direct intervention.